Israel overtook the United States as of 2020 in the consumption of pain-relieving narcotics. It's according to a new 13-page in-depth study at Jerusalem's Taub Center for Social Policy Studies. That's a worrying trend. Researchers are calling for immediate action to cut consumption and lower dosages, including promoting some safer alternatives for managing pain. So a lot of questions around this, and we're lucky to be joined now by Professor Nadav Davidovitch, chair of the Israeli Public Health Physicians Association, the director of the School of Public Health at Ben-Gurion University. Professor Davidovitch, good to have you back on air with me. We spoke many times during the pandemic, now on a different topic, so good to have you back here on our program. Look, you're one of the authors of this report, presenting the hard realities, the legal pain narcotics, their destructive effects, as you term them, but more consumption than the U.S.? I mean, how? What did you find? How is little Israel, outweighing the U.S. when it comes to this?
So the study is out from Taub Center, where I'm chairing the health policy program, together with Dr. Yanai Krenzler and Oren Miron. We actually analyzed data from Clalit Health Services, and we see that if you take the trends from 2000, there is a sharp rise about 10 years ago, and then another one recently. You mentioned COVID, so probably COVID is also part of it. But going more deeply, we have a pandemic, another one, all over the globe. We have pharmaceutical companies that were concealing facts about being addicted to several painkillers. And we see sometimes patients and physicians that maybe are not aware about how much these drugs are addictive. For example, fentanyl is 50 times more addictive than heroin. We saw in our study also that people from low socioeconomic group actually are more at risk. And first of all, we need to see the data. We need to be aware. We need to see that physicians are not misusing this option. By the way, family physicians usually know very well how to deal with painkillers. But the problem that there are sometimes other physicians, maybe orthopedic surgeons and others, that are immediately going to the so-called easy solution, and patients are not even aware that they're going to be addicted.
Well, along those lines, and I want to mention here, I'm a big fan of Dr. Andrew Weil, the integrated medicine specialist at the University of Arizona, but he promotes things along the lines. The researchers here, you're promoting safer alternatives to managing pain, I think, as you put it in this report. Like what? Are we talking about cannabis, or what other alternatives are there to help push narcotics off?
So we have lots of first-line, very safe painkillers. I'm talking about, things that are quite trivial, like low back pain. Sometimes you can even take together, paracetamol and NSAIDs, not just one type, but things that are working on several mechanisms. Of course, yes, cannabinoid sometimes can be also a good option, and also codeine related options. You don't need to use, all these very, very addictive options as first line. You need to explain your patients. The Minister of Health became also very aware and had a committee during the last year. We also just suggested that when physicians are going to prescribe, there'll be a pop-up saying, are you aware that you can have other options? This is not a first line. And awareness probably is most important, but we need to fight an epidemic that there's very deep concern here about economic issues. There is a black market. Unfortunately, when people are addicted, not everything is under the radar, and that's another thing we need to understand, including the consequences after COVID, and low socioeconomic groups were most infected.
Professor Nadav Davidovitch, I'm glad to hear that the health ministry is listening. You have some government ear here. We'll stay tuned for progress on this effort. But for the better of all of us here, thanks for the report. Thanks for being with us on the program today.
Thanks a lot.